Fantastic. So thank you everybody for joining the masterclass this afternoon. As Denise gave me such a warm introduction, I'm focusing on the unconscious to conscious embodiment of person-centeredness. And this is really around my reflective journey within the In My Shoes study. And the In My Shoes study is my PhD study. So I wanted to utilize this in a way that wasn't just about results and findings today, but more about my personal journey. And thank you, Denise. She's already got people to pop in the chat where they're from and what lands they're on. So if you haven't already done that, that'd be fantastic. Because today is about us. It's not just about me. I'd love you to join in and share. So it'd be nice to know where you're from and what position you're in. And hopefully today you'll be able to connect with something I'm saying. It might be around the person-centered practice framework. It could be around research experience. It could just be around the self-transformation that I've had. So now, got to make sure I'm on a different computer. So it's even, here we go. It's going to be one of those days, I think. Okay, before I continue, I just want to make some acknowledgements because moving forward with a PhD is not something you do on your own. There is a whole bunch of people involved from my fantastic supervisors, Professor Victoria Trainer and Val Wilson. I definitely won the lottery there, and all the people that surrounded, including those HDR students that I see someone here today that helped me through the process of a PhD, and I'm so utterly grateful. So just wanted to take a moment to really acknowledge the people in my tribe. When I was really thinking about what I wanted to get across today, I really sat in the space and considered person-centeredness and person-centered practice framework. And for me, when I first entered my PhD, it was something that wasn't at the forefront of my mind. I really had a feeling of person-centeredness, but I didn't really have that real being of person-centeredness. So I wanted to explore today that transition for me. So looking at person-centeredness from a self-reflective perspective, want to look at how we engage the person-centered practice framework. For me, I used it as a research evaluation tool. It came up a lot in the findings and outcomes of my study, but also how I used it within that self-transformative aspect of being in a PhD. And then I encourage you as we go along today to consider your own person-centered journey, where you are, how you utilize things, how you see the world. And I will pose a couple of questions as we go along to help engage you with that. Just wanted to set the premise of today's presentation in the sense that it's about a personal journey for me today. I don't consider myself an expert in person-centeredness or person-centered practices, but I do acknowledge that we're lifelong learners. It's about being in this together, and we all have a unique experience. So today I'm sharing my personal journey. You may or you may not connect with that, and that's okay because we're all unique. So, and I really am just giving a pocket, like a point in time as per the clock up there. It's not my whole journey, it's not my whole life, it's just a pocket of my PhD that I wanted to share with you today. So always great to know where we start from. So when I was thinking about this, as I said before, I had a feeling of being person-centered. So what did that mean? When I was reading the person-centered healthcare practice textbook, McCormack and colleagues really framed it well for me. So I want to take a moment to set that scene for you. So I'm going to get you to close your eyes and let's imagine that someone you love becomes very unwell and has to be admitted to hospital. As a professional, you'll have the expectation of the kind of care you want them to experience. And what's more, you will instinctively know when their care meets your standard. It might not always be clear what members of that healthcare team are doing. That makes it a good experience, but it will feel right and you will feel your loved one is in safe hands. Now let's go to a place in your mind where your loved one is getting sicker and no one seems to know what is happening, nor does there seem any sense of urgency to find out. And worse still, it gives you a sense that no one cares. Okay, I'll get you to open your eyes. So understanding what makes the difference between these two scenarios and how you can improve the experience of the care for everyone is the Centre for Person-Centeredness and Person-Centered Practice. And this is essentially where I was at the start of my journey. I knew as a nurse that I wanted to help and be a part of that person's caring experience. But I could also see that sometimes we didn't quite get the mark, like there was something missing. And so I always say I had a feeling. I had a feeling and I wanted to be involved and contribute to practice change. I just didn't know the how. At this time, I was unaware of the person-centered practice framework, and I often heard person-centered care interchange with patient-centered care. So I put myself down to where I was at this time. I just dipping my toes in the ocean. And as you can see with that center diagram, I really aligned my professional researcher and person aspects separately. I always kept my personal life separate to my professional life. So that kind of sets the scene of where it started. So I wanted to know the how. Now, the benefit of retrospectively being reflective means that we can set the scene for this presentation. So I've popped up a definition of person-centeredness there, and this really is the essence of the presentation moving forward of how we take person-centeredness and operationalize it using the person-centered practice framework. This might be the first time you've seen the framework, you might use it all the time. We're going to come to that in a second, but just so we're on the same page, the person-centered practice framework is a theoretical model. It was developed in practice for practice, and it identifies those complexities of person-centeredness at different levels of the healthcare system. So there's the 4 domains: the prerequisite, the practice environment, person-centered processes, and the outcome, and it's all encompassing by that macro context. And what's really key, and I guess the strength of the person-centered practice framework, is how the relationships of those domains and constructs come together from the outside in to have that healthful culture, so how they all work and interact together. So we're going to keep that in mind as we move forward through the presentation. Now I'm going to invite you to interact with me. So in the chat, I'd like you to consider what your awareness of that person-centered practice framework is on a scale of 0 to 10. So 0 being, geez, Alera, I just met it today on the slide before, and 10 being something you're quite familiar and aware with. So if you could take a moment, I'm just going to pop the chat up so I can see what the responses are in terms of how you feel your awareness is. Nice, we've got a 9, we've got an 8. 8, oh, this is fabulous. 7, 9, it's okay to say 0. I was 0 at one point, remember? 6, 8, fabulous. So we've got quite an awareness, a group awareness here of the person-centered practice framework. So this is fantastic. I'm going to jump to the next question then. So those that have answered are all aware of the person-centered practice. So how often do you utilize it? So on a scale of 0 to 10 again, 0 being you don't use it all, 10 being every day. Where would you sit in terms of how often you utilize it? We've got an everyday, we've got a 2, yep, 3, 10. So we've got a range, we've got quite a range happening here from 3 to 10. Lovely, 10, so it's fabulous. 5, 4. Excellent, thank you for sharing. And then the final question that I'm going to pose at the moment is, what do you utilize it for? So in terms of the person-centered practice framework, what do you utilize it for? Do you use it for evaluations? Do you use it for projects? Do you use it just something you refer to for life? If you feel brave to share, please share. Reflection of self and others, thank you. Projects, assessment and patient care, policy review, fantastic. Interactions, ways of practice, fabulous. Improving consumer care, planning and self-reflection. So huge range, loving this. Policy procedure development, patient care, policy and nursing practice. Fantastic. Integration into all practice elements, team and individual work, service review, quality improvement, engagement planning, values, mentoring. Wow. So huge range there. And a huge awareness. So this is really exciting. So this is really exciting to share. So thank you. I'm going to get you to keep that in mind as we go along, because remember, I'm coming from a place where I was probably a 0 out of 10 for the person-centered practice framework. Hadn't heard of it, hadn't used it. And I went into my PhD with that in mind. But remember, I had that feeling. So for me, it's reflecting back on this in a retrospective way and seeing how that feeling kind of evolved. So if we're starting from the outside of the person-centered practice framework and we talk about self, it's time I introduce myself a bit more. So remember how I talked about myself as a person, as a professional, and as a researcher. So I wanted to share a little bit more about myself so you could understand probably where my research is coming from. So as a person, I'm the youngest of 5. I grew up in the Illawarra. I'm a person who does like high challenge kind of activities in terms of hiking and sports. I always see myself a bit like the 2 sides of one coin, one side being quite a systematic, planned, structured person. And the netball photo probably is a clear example of that. Everybody's looking towards the pass and I'm scooting along the baseline to get a pass. So very strategic. But then the other side of the coin is I'm quite creative and easygoing. And that's where my travel and experience comes in, and my photography. I really love to travel to experience things from a not just a sight perspective, but to smell, to feel, to be present. And I use photography as a way for me to reflect on those experiences. So that's a bit about me as a person, bit of curiosity and humor as well. Me there being zipped up in my sleeping bag, very excited about my trip on the overland track. And then there's a very quiet, poised side of me. I do love to read and have my own time. So this is me as a person. How does it link as me as a professional? This is me as a professional. I've always been, I guess, gravitated towards jobs that have a high challenge, high reward type area in terms of research, education, and the emergency department, and also particular roles that have actionable outcomes that I can see changes, especially, in emergency with clinical care. And I've used education to kind of support my development of the art and science of nursing in terms of my bachelor, my graduate certificate, my master's and my doctorate. It really has engaged me to open my perspectives, to challenge my assumptions, and to really think bigger and wider. So dialing back now to me as a researcher in 2016. So this is at the start of my PhD journey. And realistically, I only had a small taste of what research was like. But what I knew is I was interested in interventional studies. I valued both numbers and words. I wanted to influence practice changes, and education was an area that I was really interested in with staff. To really, what I was seeing as a CNE was sometimes we weren't hitting the mark with education. It was becoming a bit of a tick box exercise at times. I had a conversation with a geriatrician around these new U-Butte aging simulation suits, and I thought, oh, that's really interesting. And I wanted to do some research behind it, but again, I didn't know the how. So I reached out to Professor Val Wilson and Professor Victoria Trainer, and all of a sudden I'm enrolled in a PhD, and here we are. So that's me in 2016 as a researcher. So if you were to ask me at the start of my PhD journey where I thought my study was going to sit on the person-centered practice framework, I wanted to look at that empathy with the aging suit. So I would have 100% popped that in the professionally competent aspect of the prerequisites. Nurses need the skills, knowledge, and attitudes in order to care for older people. Okay, so if we keep that in mind as we progress through the research, I'm going to show you how I've used person-centered practice framework as an evaluation aspect of my research. So what I'm going to share is just a little bit around the methods, the data collection, and the findings, so then we can see how the person-centered practice framework has really given a person-centered lens to those findings. A quick little bit around the background. Older people are going to make up 1 in 6 people by 2050. And what we're seeing, and what I found in a quality improvement, is we have care gaps in terms of what we're wanting to provide to older people to what's being received. And what we know is if we can increase and narrow these gaps, the older people are going to have better healthful outcomes, including reduced wounds, adverse outcomes in hospital, but lengths of stay and satisfaction. But also the quality of care from a nurse will go up. And they'll also have satisfaction. So in terms of quality care in older people, in the literature, it's really evident that empathy is a key component of this, and empathy in nurses reduces over time. So it was really important for me to focus on that. There is a definition of empathy over there. I took on the Carl Rogers aspect of empathy in terms of moral, affective, and cognitive and behavioural, knowing that it's multifaceted, and knowing that for me, that empathy can be enhanced through education. This was my PhD study, so I looked to evaluate the influence of an ageing simulation intervention on empathy. My 3 objectives looked at a quantitative focus in terms of measuring empathy pre and post. I looked at exploring those nurses' experiences, and then I wanted to see how they either agreed or disagreed with each other in terms of the outcomes. So, sorry, I'm trying to get this to go across another page. There we go. So the program itself just was an aging simulation suit, but it was more than just the suit. It was the design of the intervention in terms of participants undertook a pre-briefing to really set that psychological safety and their expectations for the day. The aging suit itself, as you can see in the photo, simulates motor sensory changes of aging. And I say potential because not everybody's going to be at that level. Other people are going to function differently, but we're just trying to show that there are motor sensory changes. So hearing, sight impairments, mobility restrictions, dexterity, things like that. And what they would do is they would undertake scenarios based on activities older people would face in hospital. So making a cup of tea, and then they would share their experiences in a debrief and reflect on what those experiences meant to them and how they were going to impact their care. So it was across ISLA, 3 different sites and 7 different units, and we had 106 people go through 7 sessions. Not to stay on this for too long, but I used a mixed method study. I collected qualitative and quantitative data concurrently, like I said, and then I looked at the 2 of them together about how they integrated. Now I could spend a whole session talking about my philosophical framework, but what I want to pull out of this was through this process, I really resonated with pragmatism, but beyond just the what works approach, I really connected with the underlying assumptions of pragmatism of actionable knowledge. I knew for me, empathy was something that could be enhanced, linking experience to action. It had to happen with reflections on their experience and inquiry as experimental process. So it had to be something that people were doing. These are just, again, these are some of the findings in terms of the quantitative. I saw changes in their empathy scores pre and post. They had a really rich experience in the simulation space in terms of their empathy, their person-centered moments, that shift from their self, like their feelings of this is making it hard for me, to what it would be like for an older person. But there was also a real focus on influencing factors. Empathy is very individual, but they're all, system approaches. Just some nice quotes from participants about how they look deeper into a patient now. They found it challenging to do the buttons up on their shirt. They wanted to curl into a ball and pretend the world didn't exist. They let the patients move at their own pace, and it made them realise that our patients are trying their best. So you can see there's a range of findings there that are beyond just empathy. So let's bring it back, that as an evaluation tool, now that I sit back retrospectively and look, this is what I see now with the person-centered practice framework in terms of how the findings are influenced with a person-centered lens. So yes, in the prerequisites, they definitely had an improvement in their professional competence in terms of empathy and attitudes, but it was so much more than that in terms of their communication improved. I'm not going to go through everything, but one thing I do want to jump out was there's this knowing self was actually really interesting because people connected with their own aging process and what they wanted and what their expectations were going to be. And that influenced as well how they were going to approach life after they left the aging simulation in terms of diet and exercise. It also brought up the practice environment in terms of the physical space. So there was a lot of conversation around lighting, equipment, noise, and how that can influence our ability to be empathetic to older people. So when you look at it from a person-centered practice framework and that operationalizing person-centeredness, you can see how it's more than where I came from. So this is my evolution. So that's the way I use the person-centered practice framework as an evaluation. But then there was this other aspect, the other side of the coin, which was around me as a person and my self-transformation. Going into a PhD journey, I honestly felt I was pretty confident in who I was as myself, but coming out the other end, there are so many other aspects that I've learnt along the way. So I am mindful of the time and the delay with the start. So I'm gonna jump through this, but I wanted to show the process of a PhD in terms of there are a lot of vulnerability and emotions. There a lot of other opportunities than just a thesis you're producing in terms of building self, in terms of communication and connection with others, and how you reflect on that process. And I honestly feel that doing a PhD is a little bit like going down the rabbit hole, but opening up our perspective. And look, there's a bit of honesty in terms of how have I no idea what I'm doing. So sorry, I got distracted by the chat and I just saw a question about how did you measure this. I will happily answer questions at the end if that's okay, just because I'm mindful of that. This is the outcome for me as a PhD. You come in thinking from a PhD perspective that you're going to produce the thesis, but what you actually get is this diagram on the right, and there's so much more to a PhD in terms of knowledge sharing, expertise, collaboration, and what I have found in terms of me is about that evolution of self. So this is where I'm at now. So I've starred on the person-centered practice framework for me in terms of my PhD a lot more around the prerequisites and knowing self, because I honestly feel, yes, I've got the technical skills of research, but for me, the transformative part of my person-centeredness has really come from self. And you can see how that diagram there has now changed, that I no longer see myself as separate components in terms of professional, personal, and researcher. It's the combination of that. Everything's connected. I find that building relationships is key, and that connection with others. What you say and how you say is important. So I'm really conscious of the words I use and how I engage with others. And I think it's really important to point out it's a state of becoming. How I am now is different to how I was at the start of my PhD, and how I am now is going to be different to how I am in a few years' time. It's an evolving process, it's a journey, it's not stagnant, and embracing that in terms of that is okay. And that why for me it's about bite-sized chunks, and it's about this is me, how can I embody this on a daily basis. So that's going to bring me to the end, and I'm going to pose a question to you now. It's been great that the fact that you all come in with an awareness, the PC, person-centered practice framework, but I'm just wondering now that you've had more of a think and been engaged in this session, is there a different way that you might utilize the PCP, person-centered practice framework, when you go back into practice, or are you still happy with how you're using it? If anybody would like to share in the chat, that would be great. Oh, good. Somebody else has had connection problems. I feel like we're part of a group now.
Yeah, that's okay. If anybody wants to share any thoughts as well, that would be fabulous.
Bringing it into the peri-op space.
How
nice.
might you do that, Kendra?
Yeah.
Hello.
Kendra?
Yeah.
Hi, Kendra. I don't want to put you on the spot, but
Yeah,
I'm going to put you on the spot. You know me. A little bit challenging, but yeah, what do you think?
I don't think this model's actually forefront of our minds.
Yes.
So even just having that up around and bringing that into one of our quality and safety meetings maybe might be a good place to start.
Yeah, that's great. Thank you. Claudia, you've got here more focus on self. How might you use the framework for yourself?
Look, I just realised the time. I've got to rush to a meeting that started at 3, so I'm running super late. But I think I always tend to focus on outer. So I think that when you were talking about self and reflection on self, I think that's really important. Something I can definitely take away from that.
Thank you, Claudia. Oh, thank you. Oh, Catherine, that was you, was it? Somebody also asked, "What is this?" And I wondered, was that you, Catherine? No.
Yes, that was me that said the initial question was really understanding it, because I've seen this framework and I've heard it spoken about and referred to, but I guess, you know, really understanding it and is what I was hoping to get from this session. So
I can add to that. I think for me, and look, Catherine, the person-centered practice framework is quite complex, and I think the more you utilize it and the more you use it for your needs, the more you become familiar with it. So I think for today, even just going away with a you know, like being ignited to want to explore it further. That book I put up in my slides, which you'll be able to see, is a great starting point in terms of more information. There's a chapter on I think each of the areas, and really gets to the depth, because I don't think I would be able to give in the 30 minutes we've had today the real real depth of the PCPF, but just a bit of an introduction to my journey. Yeah.
Can I just add to that, that if you look at the circles, what it's saying is to get into that middle. I think maybe this is a very short version, Catherine. To get that helpful culture, we need to have person-centered processes in ourselves and in the way that we work with each other and with our patients. And then the care environment is going to be really important, like the leadership within that care environment, how we work with each other. And then the individual prerequisites. So for me, being, am I professionally competent in my job, or, you know, do I have enough knowing of myself to know that I have to work on these things, or my interpersonal skills? And all of that won't work if you haven't got a macro context or policies and practice, or that real high level leadership who supports that, so that you're not in conflict where you have staff wanting to be person-centered and all our policies and strategic practices are that we're not. So I think, as Alera said, there's a great chapter in the person-centered practice book from McCormack McCann's 2017, which really it's not simple, but it simplifies it to understand it. Yvonne, you've said patient-centered. Yes, they are, but are not, and would love clinicians to understand that. Yvonne, how do you think we could let clinicians know the difference between person-centered care and patient-centered care?
I think there probably needs to be a lot more work done in this space along with practice development, but I just tend to, I guess, correct people when I hear it not used correctly, and I do tend to lean in my works as far as service reviews and procedure development, that towards using the person-centered, not the patient-centered, depending on what we're about. But yeah, because pretty much today we should really be looking at it from that bigger view of person-centered.
And if we look at, I mean, for those people that are in New South Wales Health, if we look at the ministry and the policies and the frameworks that are coming from them, they're now talking about person-centeredness, not patient-centered. So we've got some sort of strategic component to support and help us drive that language change. Is it Brian? Could you maybe think about what you're saying there?
Sorry, I was just sort of elaborating that for me personally, when I use the person-centered practice framework, I really refocusing also about circles of concern, influence, and control. So that kind of helps me articulate to teams and individuals that I'm working with and how to center themselves when they're using it as well. So for example, the macro element would be your circles of concern, whereas your prerequisites in your practice environment are your influences. And then your control is the person-centered practice that you have a greater influence on, tone or how you engage or other things like that. Whereas you may not necessarily be able to change state legislation, but you can definitely apply legislation into your practice, if that makes sense.
Thank you. And Kendra's is there a poster? If you go on and put in the person-centered practice framework into Google Images, you'll come up with a poster that you can print out in colour. And we've got all the books here as well. If you need to read something, that would be great. Thank you. Does anybody else have anything that they would like to contribute to the conversation? You can put your hand up, say something in the chat. Okay. Is that you, Miriam?
Yes, it is.
I meant just put your hand up with the little chat thing. I'm like, there's 49 people on.
I was starting to look for it while you just said, oh, is that Miriam? Sorry about that. I'm so technical, aren't I? I was just thought I'd add to the comment that I put in there that I've been thinking about what makes person-centered research. And the reason why this resonated was that, Alera, when you were going through that, how you move from that, I have a feeling, to what you were doing, because that's, to be honest, that's how I feel like I've actually been with my research. I thought I could be more concrete in how I use the framework to both set out the design and evaluation and itemise it. And I think probably when I see how you've done that, I probably will be able to more. But I became more involved with the thought that it is actually more about how I'm doing it than what I'm doing, because in some ways the framework itself, it's not fitting into those concrete areas I need to. It would actually direct what people might do or say if I did that. But anyhow, that was very helpful to sort of realise that how you might apply person-centeredness and be person-centeredness, and then how you might, with later reflection, be able to actually articulate it even better.
I think that's a very good point, Miriam, is, like I said, when I went into it, I knew I wanted to look at empathy, and I knew I wanted to use an experiential approach. I didn't actually realise the extent of where it could sit. So it's not like I was forcing them into categories, if that makes sense, that they just authentically on reflection, I'm like, wow, it was a real kind of moment of significance for me when I got to that kind of analysis and findings about how much of myself and the way I function fitted within the person-centered practice framework. And probably during that write-up, I always say it's quite a lot of energy that goes up into writing up research, but I didn't actually find that there was a roadblock where something didn't fit within that wider picture. So I think for me, it was a real clarifying moment that I was on that conscious path.
Thank you, Alera. Thank you very much. We've come to the end, and I think that just on that point, Alera, about consciousness, I think when you look at the practice framework, it allows you to be conscious about where you're sitting with that and your alignment to that, and that's okay. That's all about learning and reflection. But we've got another one in a couple. We'll send out the date of the next one. Can I also ask you to do, you've got a little QR code, and Alera's left all the details there
I'll just
of her thesis.
Yeah.
And we just wanted to say thank you very much for coming and joining us. It's just lovely to have these conversations and keep this going. And hopefully somebody might have done the evaluation and send it back to us, and we can try and tailor these workshops to something that's you know, related to something that you want to learn, because that's all about being person-centered. What are the people who are on here and what are their interests? So thank you so much. Enjoy the rest of your day. It's looking a bit bleak out here in Wollongong, or the Gong as we call it. I hope your day is looking a little bit better. And as I said, just that conscious thoughts around the person-centered practice framework, and where are you sitting and what are the influences on your own person-centeredness. So thank you very much, and we'll catch you next time.